And I thought it was very important on the last one, and I'm going to just reinforce it just very briefly here to emphasize the importance of mind-body connection, which has been very, very well established in the hypnotic field in various manifestations for a very, very long time. When I say a long time, at least until, I suppose, 1746 and Esdale's work, certainly in the 1880s and 90s, later on with Bernheim and Liabeau, and later on with Coué, that connection. And of course, it's that connection that we're specifically interested in. Today, the tendency is to think of hypnosis as purely something which, if it does anything at all, as the skeptics would say, might do things emotionally, possibly mentally. But bear in mind that all the work of the early practitioners really wasn't that concerned with the mental as such. They were really concerned with the mind-body connection. In other words, what effect changing the mental status, the emotional status would have upon the physical body. So really, when we're talking about hypnosis, and forgive me for a slurp of coffee. When we're talking about hypnosis in relation to fertility, we're talking very much about that mind-body connection, and I spoke about that in detail last time, so I don't want to go over it too much again here. And the other thing I mentioned, which is very, very important, is this notion of when we talk about whether hypnosis is effective or it's not effective, or how it's effective, or when and where, the types of studies done, and where we have to be cautious because of the variation in that study. And I referenced briefly, and again I reference it briefly here, the work of my favourite hypnosis practitioner almost, probably actually, of old, Dave Ellman. I'm going to come back to him much later on in the program. So for those of you that have heard me before, I won't be devoting a lot of this particular one to Dave Ellman. Oh, what a relief, I hear you say. But what I do want to do in this program is I want to really examine with you the studies that have been done in connection with a mind-body connection as far as fertility and infertility is concerned. And of course, naturally, some of those are purely an examination of hypnosis in relation to that, others other things. And the reason I wanted to, I think this is very, very important, is if you are considering, or have even, and probably I'm guessing that any of you who are watching this program who are struggling with fertility, or whose partner is struggling with fertility, or who has a friend or close family member who is suffering with that, probably you don't even know at first that hypnosis or mind-body work can be of any help at all, because the ground for fertility, the high ground of it, has been so much taken by purely medical interventions, ART, assisted reproductive therapies of various types, including in vitro fertilization and other things. It's such a high degree that you'll wonder how it can even be possible. But what I'm going to show you now is that there has been significant and ongoing work that actually has originated a long time ago as far as hypnosis specifically, and other mind-body practices related to the question of fertility, infertility, sterility is concerned. Now, the oldest of these that I'm aware of goes back to our friend Dave Ellman in 1952, but I'm not actually going to reference that one in this program. I've got a very specific reason for wanting to reference that in the next program, because in the next program I'm going to talk about exactly what you should be looking for and what I believe is the gold standard for an effective fertility program assisted by hypnosis. And I'm going to reference Ellman a lot there because I want to describe how the work that he did as early as the 1950s is really a benchmark for all of us if properly understood. Unfortunately, it's not very well understood. I mentioned the work of this gentleman, James Schwartz, who's written a for the last part, I have to say an excellent book, which I'm going to talk to. And I just want to say I want to thank James Schwartz for having put this together. It's very helpful. I mean, it has, in my opinion, there are a couple of major flaws, but like all of us, Mr. Schwartz isn't perfect. But one of the major flaws in this book is the complete non-mentioning of the work of Dave Ellman, not because I am such a fan of Dave Ellman, although I am, but because he and the doctors that he trained are really the true originators of this type of work that I'm going to describe. And either Mr. Schwartz doesn't know that, which I'm sad if he doesn't know that, for him actually, and his clients, or he chooses not to mention it. I hope it's the former rather than the latter, because that would be reprehensible, and I can't believe that's the case. So we're going to talk about what Ellman did in the next program and how it has an impact upon the work that not only I do, but what I believe is a sound methodologies. So here I want to reference other things. And let's again start off with a broader picture and move into specific studies. Now, looking at these studies can sometimes be very dry work, even if the subject matter is, of course, of great interest to you. So I'm hoping that when I go through them, rather than go through them in a dry and rather boring manner, that as I go through them, I'm going to comment on them, annotate them. So for you, the feeling should be going through the evidence, at least some of the evidence, with somebody who's as it were, a friendly expert, like a conversation. Unlike many of my shows, it's going to mean that I'm going to have to reference some of my notes, because I want to make sure that I give the proper accreditation to the people who engaged in these studies and published their results, to whom, again, we owe a debt. But let's start off with a broad, what I would call conventional medical view, which is that the conventional medical view is the question of fertility, infertility, sterility is really a purely physical phenomena. If you get the physical bits operating correctly, and then you should be able to have conception, and if you manage the pregnancy carefully and there are no other problems, you should finish up with a live birth. That's the general medical conception of it. Now, I have to say that this, termed in that way, is an extremely, in my opinion, crude and limited way of looking at the mind-body organism. And I will say that actually, even in the medical realm, it's fairly well acknowledged that, of course, there is a mind-body connection, that it's all not just about chemistry or genes, or there's much more to it than that. There's much that we don't understand and that we don't know. But it's long been recognised, probably since the days of Hippocrates, that the mind has an effect upon the body. And most medical people will make that acknowledgement, although the terms in which it's described are very, very loose and unformed. But even in the simplest way, emotions and mental processes have an effect upon the body. It's not just a question of chemicals. So one of the things that I really question is why on earth people don't think in the medical field, or generally, that this wouldn't have an effect upon pregnancy or the ability to conceive, why that would be divorced from everything else. It doesn't make any sense. And it's a kind of a blindness, I think. And so I really want to show how important that effect is, not just as a result of my assertions, but as a result of some of the work that has been done by some very, very knowledgeable, interesting and dedicated people in this field, to show that there is a true mind-body connection, and this is demonstrated by the studies. Now, one of the overarching views in these studies, and actually is in Mr. Schwartz's book, which he states, which again we'll talk a little bit more about on the next program, is that basically problems to do with the mind-body connection and questions of fertility come down to almost a single factor, and that is what the medical community call stress, sometimes distress. And that therefore, if you change that stress or distress, then you can change the capacity or enhance the capacity for the woman to become pregnant. So it really comes down to a form of stress reduction. Now, you've heard me talk about this before in other matters. This is a very old medical theme. And in some respects, I agree with it, but in many respects, I believe the overall view is extremely limited and frankly quite shallow and crude. Because the idea is you just reduce everybody's stress enough, all our problems almost are going to go away physically. They're all a result of stress. And of course, when there are problems, mental, emotional, when there are some of the fixed ideas and programs that I've talked about in previous shows, of course, one of the manifestations of that, or one of the things that appears, is stress. The problem with that term is stress is such a broad term, it really doesn't say very, very much. It's too vague, it's too non-specific for my liking. And as you've heard me talk about before, I did a whole program, 2 programs I believe, on stress reduction. Stress in itself isn't always a negative thing. There's positive stresses as well as negative stresses. And so just talking about it in terms of stress, in my opinion, doesn't really get to the core of the matter. And there is something else in connection with that, which is that there's an overall belief that if we just do lots of things to de-stress ourselves, everything's going to be okay as far as fertility is concerned and many other things. And again, I sincerely wish that that was true. But the truth of the matter is not that. There is more to it than that. It's more subtle than that. Unfortunately, we can't just relax away all of our problems, physical, emotional and mental. And we can't relax away, in and of itself, problems connected with fertility and infertility. So whilst we're going to talk about a background of stress, because this is what a lot of these point to, I want to point out some more subtle elements as we go through. Because the program that I use and the program that I promote and facilitate for women who are having difficulty conceiving and their partners goes a lot beyond simple stress reduction. So, and I want you to bear that in mind. So, the other thing there's one other thing as well. The very interesting thing about this is all of these studies focus only on women. Now, of course, you may say, well, obviously, that's obvious. Only women can bear children. Only women can become pregnant. Surely the whole thing should be about women. And this seems to be the underlying view of all of these. But what we're going to see on the next show, see, I already want to have you coming back to me for the next show, is that Mr. Ellman, and most importantly, not just him, but the doctors who developed the program with him in the 1950s, also believed that there was a hypnotic role as far as the men were concerned as well. It wasn't always about women, which in many ways I think is much more enlightened than some of the things that we are seeing today, which are wholly focused on women. Again, I'm going to talk about that more in the next one, but just bear it in mind. So let's have a look at where the modern studies start. And actually, Mr. Schwartz, the first one that he says he's aware of is a case reported in a book called Psychosomatics. Now, psychosomatics, when this book was written in 1970, was still a fairly new term. I think it probably was a new term in the medical world. Although the mind-body connection had long been established. And this is one of the things I want to point out to start with. We in the field of hypnosis have long known about mind-body connection. It isn't news to us. But to the medical world, it seemed to be amazing. And actually, it isn't even new to the medical world, because if one looks into medical history, going back in the early part of the century, and in the late 1800s, and even before, it was recognised that there was a mind-body connection. It wasn't, oh, this is so amazing. But like many of these things, it gets forgotten. People in the past get dismissed, and so there has to be a rediscovery of these things. So in this book, 1970, Psychosomatics, doctors Howard and Martha Lewis reported several cases where they wanted to demonstrate that there was a mind-body connection. And one of the ones that came up was the case of a lady called Rena. Now, it doesn't matter what her name is, but that was her name. Now, Rena wasn't their patient. She was the patient of another doctor, Dr. Flanders Dunbar. And Rena said that she stated, and I quote, "There's nothing I want so much as a baby," unquote. But she couldn't get pregnant. And what her doctor found is that she had heard a lot about the dangers and possible complications of pregnancy, and it played upon her mind. And it produced in her a very specific form of anxiety. But here is the interesting thing. Dr. Flanders Dunbar discovered that that fear and anxiety had an effect of tightening the muscles around the fallopian tubes at the time of ovulation, the time when the egg is produced. Now, that contraction of those muscles around the fallopian tubes was involuntary. She couldn't, in other words, it's not under her conscious control, of course, it's under the control, as I would say, of the subconscious mind. And when that occurs, it literally makes conception impossible. And this was a very, very direct link observed physically between the mind and the body, between the emotions and the body. Now, the interesting thing is, if either doctors Lewis, Howard or Martha, or doctors Flanders Dunbar had ever studied, and I don't know if they have, but they certainly don't give reference to it, any of the works of Emile Coué and his teachers and mentors, Professor Bernheim and Dr. Leopold, they wouldn't really have been very surprised by this. Because one of Coué's laws of hypnosis and autosuggestion is the law he calls of reversed effect, or actually sometimes of reversed effort, which says that the more you want something to happen, when there is present a subconscious fear of it, the more effort that you put towards it, the less likely it is to happen. This is a fairly well-known law in hypnosis. And so in the case of Rena, as she states, there's nothing she wants so much as a baby. She's trying with her partner, and all her mind is set there. But underlying it, there's all these fears and anxieties of what may happen if she actually conceives. And these act as a block. And so in modern times, this is the first mention of this problem. But again, none of this would have been any surprise to Coué. It wouldn't have been any surprise to Ellman and all the doctors that he worked with. They knew that. They called it, they actually had terms for it. They called it a fear of pregnancy, a fear of childbirth, almost like a phobia. So again, that's the first study. Now, that led to several other studies, and several other studies confirm that link between anxiety, fear, and the inability to conceive. Yale, the university, conducts a small study which it calls Fertility and Sterility. And its aim was to look specifically at the emotional issues affecting sterility. Now, they took a group of women. It's not a particularly, it wasn't a particularly large group. It was a small group, and they divided that group into two. A very simple study. One of those groups worked with a therapist, and I don't have the details of exactly the nature of the therapy that they did or how. But one group worked with a therapist, and the others didn't. That was their control group. 60% of those who worked with a therapist were able, I believe within a year, to conceive. and only 11% of the control group was. Now again, I don't know precisely what they did and the exact nature of the therapy. Obviously, we don't know what the individual sessions look like, and therapy can be very broad. But the difference statistically between that is enormous. We're not talking about 11% and 15% or even 11% and 20%. We're talking about 11% and 60%. Now, it wasn't a big group. I believe the group was under 50 in number, so some people could argue that that's not statistically relevant, but it indicates that there's something there. That sort of disparity statistically is extremely significant. Now, we move on a little bit to 1993, when a group in something which was called the Fertility, actually it was called the Sterility and Fertility Journal, Wasser, Sewell and Souls, I'm going to have to put my glasses on for this one, were examining the effects of stress in the likelihood of pregnancy. And the basic notion is that increased stress decreased the likelihood of pregnancy and vice versa, significantly. And in the same year, in the Journal of Psychosomatics, in 1993, they wanted to examine success rates in IVF treatments, in vitro fertilization. That's specifically what they were looking at, because they wanted to see if there was an emotional mental effect. And so one of the ways in which they did this was that women were asked, before they engaged in vitro fertilization procedures, to give a subjectively determined level of their depressiveness, how depressed they felt they were prior to IVF procedures. Now again, we could easily poke holes in this. We could say that there was just a group and a control group. We could say that the method of determining levels of depressiveness were subjective, not easily measurable, not particularly scientific. Of course we can do that. But then of course we might be able to say the same for thousands upon thousands of similar studies which are embarked upon and the results of which are published in various journals for over the last few decades. So we can point the same finger at any of them. But the most significant thing about this study was that those women with elevated levels had less than half the success rate with in vitro fertilization as women who were not depressed. Now, this is for me, this is an extremely interesting result for a number of reasons. The first is it indicates that there is a mind-body component beyond the purely physical. Because if there wasn't, then it wouldn't really make any difference what the mental or emotional condition of any of the women participating in IVF was. If it was a purely physical question, then basically the results in the control group and the other group would be almost identical. There would be no statistical difference between them. And again, it wouldn't matter what form of therapy was done. It doesn't matter about hypnosis or what the therapy was. It would make no difference whatsoever. You've heard me mention before that of course there are things where that mind-body connection, emotionally, physically, don't really make any difference. Let me give you just a quick reminder. Diseases of malnutrition. As you've heard me say on other shows and many times, if we don't have enough water as human beings, we die. It's as simple as that. The mind-body connection doesn't really exist except in as much as what you experience as you become dehydrated and eventually die of thirst. If we don't have sufficient C in our bodies, we get scurvy. If we don't have sufficient niacin in our bodies, we get pellagra. This is not a mind-body connection. This is chemistry. If you don't have enough of these things, and of course with biological individuality, how quickly we're affected by a lack of those nutrients is going to vary, but in the end it's going to affect all of us simply because we're human beings and we are subject to certain chemical realities. But here we're talking about something different. Here we're talking about a procedure, and again, there are differences in IVF procedures. They're not all standard, they're not all the same. There are significant differences, which we'll talk about more. But again, with the sorts of IVF procedures that were being done in this study in 1993, those with elevated depression's level had less than half the success rate of women who were not depressed by their own subjective measures. So for those of you who are contemplating embarking on IVF, even if you don't wholly buy into the message that hypnosis or other mind-body processes can be helpful, it seems to me a pretty good bet, doesn't it, to do it, to do some sort of mind-body process. Certainly, it doesn't harm. There's no indication that any harm's been done. And the studies seem to indicate, and there have been subsequent studies which we can talk about in a minute, that it could be very, very helpful. Which means, for those of you that are contemplating taking that path, that IVF can be greatly enhanced and improved. And yet, how much do we hear about that? Hardly any. Hardly any work about that at all. Now, also, excuse me, another very interesting study was done in 1993. A lot of interesting work done in the mid-80s to mid-90s here. A lot of interest in it. And this work was done by Dr. Alice Domar, and she comes up, she's going to come up in a few different times. Now, Dr. Domar, I don't know if she's still in practice, I have to confess, but she was at the time the assistant professor at Harvard and the director of a women's health program at the Beth Israel Deaconess Medical Center. So she's a well-qualified doctor, interested in the mind-body connection as far as fertility and infertility is concerned. Now, what she studies, she actually published 14 major studies examining how levels of distress affect in vitro fertilization. And I don't want to, it's not necessary for me to go through all of those studies. If you check her name, I'm sure you can find them in various journals. But what's very interesting is her summary. She stated that 30 to 50% of women struggling with fertility report depressive symptoms. 30 to 50%. Again, a significant number. Depressed women in one study had only 50% of the pregnancy rates of those not reporting any level of depression. So if we just take that element, depression, and again, depression can be variously defined, I know. But again, it indicates that there is a strong mind-body connection. Quite simply, if you are depressed, if you are sad, if you are stressed as a result of that depression or anything else, her work and the work of others indicate that you're less likely to conceive. It's going to be more of a struggle for you. She actually stated at a medical conference that she believed the effects of this depressive condition, as far as the effects on potentially inhibiting conception and a healthy live birth, are equal to those effects of people who are suffering from cancer, HIV, or heart disease. An extraordinary assertion from a medical doctor after she'd spent a long time working with many women. Now again, these are things that both of these studies show the effects of distress. Just that factor alone. and depression. And I want to make it very clear that I certainly don't believe they're the only things that affect it at all. Not by any means. And we're going to talk more about those things later. Let's move forward a little bit, just a year. And actually now we're going to go to across the pond, as we say in the UK, because these studies come from the United Kingdom. And there, in 1994, a gentleman called Philip Quinn was the director of the Association of Applied Hypnosis. And he worked with a lady called Dr. Elizabeth Muir. And this is the first time when the term psychosomatic infertility comes up. Muir works with another doctor, Dr. Michael Paulson, and they start off with a group of women. It's a fairly small study, just 40 women. And again, some people could poke holes in it and say what they find isn't statistically significant because the group size is too small, but bear with me. This group of women were between 26 and 42 years of age, which is fairly similar to the ages of women who are most likely to want to try some form of infertility treatment, whether it's in vitro fertilization or anything else, whatever. So it's really representative. Now, of that group, 9 used either in vitro fertilization or a process called gametic intrafallopian transfer. Sometimes the acronym for that is GIFT. In other words, they use some form of physical intervention. Now, what happened to this group is all of them were given 9 hypnotherapy sessions, as it was termed. Again, as you've heard me say on the last program, who knows exactly what those hypnotherapy sessions consisted of? My guess, looking at the work of Philip Quinn, as far as I can tell, it was not exactly the same type of hypnosis that I do. But I have to say, with the greatest respect, to Philip Quinn, I think it was actually, quite honestly, a pretty weak form of hypnosis. The very fact that they're doing 9 hypnotherapy sessions tends to indicate that it's probably largely creative visualization, probably fairly light states of hypnosis, because if that was the case, you probably really wouldn't need 9 sessions for the sort of work that we're talking about. But be that as it may, these previously infertile women, this is what happened. 65%, in other words 26, of those women go on to have live births. 65%. Now, that in itself is an extraordinary result with previously infertile women. And when I say infertile, these women were spending a year to 2 years attempting to become pregnant. So it's not just somebody that decides after trying to become pregnant, a month or two, well, I can't do it. These are women that are really wanting to have a baby. Now, the interesting thing, apart from that extraordinary rate of live birth, and by the way, we're going to talk about that again more because we want to measure this by live birth, not just by conception, because of course the ultimate goal is not just to conceive, of course, but to have a healthy live baby. But the interesting thing is Dr. Muir observed with Dr. Paulson that the pregnancies themselves were trouble-free, that the births, the labours were short when it came to the birthing time, and that the births themselves were largely uncomplicated for these women. Now, some may argue, and I've seen it argued in this small study, that the mean age was too young to really be significant because the mean age in this small group on the mean was 32. And some would say, well, that's it's skewed towards the young. But you're going to see in what we're about to examine, remember that figure of 65%. You're going to see how favourably, that compares with conventional in vitro fertilisation as done by a very, very wide and large-scale study conducted by the CDC, the Centre for Disease Control. Listen out for that in a moment. But here I want to read you something that Muir observes. She says, and I quote, "Most of the women I see have psychosomatic infertility related to conflicts or unresolved issues about having a baby. A combination of counselling and hypnotherapy can remove these problems," unquote. And in subsequent programs, Muir had a 45% success rate, 45% with previously infertile women. And she firmly believed that the unresolved issues and conflicts relating to having a baby were more important factors in determining the likelihood for conception and a healthy live birth than age alone. An extraordinary assertion, because if one listens to most conventional medical opinion currently, age is usually the most significant factor. You know, they basically chart it as you get older and older and older, your chances of conception, you know, go down and down and down. But she says that's not the most important factor. Now, this is one of the areas where I think it's likely that the type of hypnosis that she was doing, if you're going to just talk about that element of it, or what she was doing, but rather I suppose Philip Quinn was doing, was somewhat limited. And the reason is because I believe that they were using counselling to deal with unresolved conflicts, and hypnosis probably just to create various forms of positive direct suggestion and probably to reduce stress. Again, no harm in that, but weak by comparison to what I'm proposing, and certainly the sort of thing that Ellman did by comparison. So again, it's based upon the general idea that you can sort things out in the conscious mind and that will affect things in the subconscious mind. And you've heard me say many times, I really don't believe it works like that. Because these conflicts and unresolved issues don't just exist, even if they're perceived fully in the conscious mind, which is surprising if they are, they're in the subconscious. And that's what hypnosis practitioners, or good ones, deal with. We operate in the world of the subconscious mind. But even if one was to say, I don't know what the quality of the counselling was like, or I don't know how good the hypnosis was, this is still an extraordinary result, particularly as we're going to see later on, as this compares with conventional treatments without the use of any type of mind-body therapy. Let's wind it forward 5 years. And again, we come back to Dr. Alice Domar, who we mentioned in 93. She's still active in 1999. And she does this work she reports in the Journal of the American Medical Women's Association. Not quite sure if that's an American Association for Medical Women or it's American Medical Association for Women. Kind of unclear, but it doesn't really matter. Because what happens here is she takes a group of 132 infertile women. So this is a bigger study. The average infertility duration is 3.5 years. Now, she mentions, as she'd mentioned earlier on, that depression and depressive symptoms were a huge factor in determining the likelihood of conception and a healthy live birth. So the tool that she uses to deal with that was termed as some form of cognitive behavioural therapy. So she doesn't choose to use hypnosis or any other body-mind work, or it's not done in this study. She uses cognitive behavioural therapy. Now, you've heard me talk a little bit sometimes about cognitive behavioural therapy. It's a very commonly used term and practice these days. There is not widespread universal agreement as to exactly what constitutes cognitive behavioural therapy. Many people have different definitions of it, what's included, but it's a combination of talk therapy, behavioural therapy, we can say in some form. I would not say, although some cognitive behavioural therapists may disagree with me, that it has anything to do with the subconscious mind. And I'm not going to get on my hobby horse about CBT here. It doesn't matter for the purposes of this study. What matters is that with this tool, there was those previously infertile women, 42% of those women were able to conceive and have a healthy live birth. And perhaps the most striking aspect of it is that the most depressed of that group of 132, by whatever measures Dr. Alice Domar was using, that subgroup had the highest success rate, because that subgroup had a 57% success rate. So in other words, that again is an indicator, I would say, from Dr. Domar's study, that depression, however defined, is a major factor in the ability of women to conceive. Or, put around the other way, it's a major inhibitor or a major contributor towards infertility or even sterility. So again, this is a very, very significant, in my opinion, study. And Dr. Alice Domar isn't finished. She seems to be a very active lady and very, very serious and passionate. Because in a paper titled Fertility and Sterility, published in 2000 out of the Harvard Medical School, a further group is taken, 184 women. And these women have had a 1 to 2 years of trying to conceive. And again, I believe they use cognitive behavioural therapy, but again, let's just say some form of mind-body therapy. And 55% of that group become pregnant, have a live birth. And again, an extraordinary result by any standards. You see, the thing about this is that the success rates are so high that it's beyond the possibilities of mere statistical probability. It goes way beyond that. In other words, what am I saying in simplest terms? Something's happening. Something's occurring. So ignore these factors at your peril. If you're somebody, even who's using assisted reproductive therapies of any type, if you're using them without using a mind-body element, in other words, addressing the emotional or mental, you're shortchanging yourself. You're limiting your chances of success, certainly. And again, it's very, very difficult to just ignore these studies, to just say, well, you know, it's all in people's head. It doesn't make any difference at all. These are serious-minded people in serious-minded institutions undergoing significant and probably pretty expensive studies. And I think their results are important. Let's go forward a few years to 2004. Here we go to the European Society of Human Reproduction and Embryology. And at a conference, an Israeli professor, and again, I don't know if this gentleman is in practice anymore, Dr. Eliyahu Levitas, actually talks about the use of hypnosis. Again, I'm not precisely clear the nature of the hypnosis. But the interesting thing is, it was not hypnosis done to deal with emotional, depressive causes or anything like that. It's very, very specific in this study. And the hypnosis is done at the time of embryo transfer in an in vitro fertilization procedure. It's done at that time and only at that time. Now that tells me as a hypnosis practitioner that it must have been pretty brief, the hypnotic session. It probably was almost invariably some form of direct suggestion. I can't believe there was any form of regression or true hypnotherapy or anything like that done. But it's there to enhance. He reports, and by the way, they had a control group, obviously those that didn't receive hypnosis at the time of embryo transfer. In the control group, 14% of the control group succeeded in becoming pregnant. Now again, I'm not sure he's talking here because I haven't looked at some of the details of this study, I'm sorry to report, only a summary of it. I'm not sure if these people, 14% or the other percent, went on to have a live birth, but let's just keep it at that for the time being from what we know. But the group that had hypnosis, 28% of them became pregnant. In other words, if you had the hypnosis at the time of the transfer of the embryo in an IVF process, you were twice as likely to become pregnant, twice as likely. Now again, if I was a large drug company and I'd managed to develop a drug that could more than double the chances of pregnancy at the time of embryo transfer in IVF, or if I'd invented such a thing, I wouldn't need to work anymore. Because if I could patent that drug or anything that did anything like that, I'd probably be a very, very, very wealthy man. And if I was working as a researcher for a drug company and we did a study, they'd probably be very happy with me because they'd make a great deal of money out of it. But here we have a simple, harmless, intervention-free procedure involving just hypnosis, which can more than double the likelihood of women becoming pregnant. Extraordinary. An extraordinary result, which he reported to the European Society of Human Reproduction Embryology in 2004. Let's go forward another couple of years. Let's go to 2006. And here we have a study from the United States, actually specifically from Emory University in Atlanta, Georgia. And this was a very interesting study conducted by Dr. Sarah Berger. Now, what the good doctor is looking at is what happens when there are high levels of cortisol, the stress hormone. And specifically, she's looking at something quite chemical. She wants to see if cortisol inhibits something called gonadotropin release hormone, the gonadotropin release hormone, or sometimes known as GnRH. That's the hormone that stimulates ovulation. So, where does she start? With women who have who are not ovulating, amenorrhea. She starts there. Now, again, her tool of choice for the body-mind connection is cognitive behavioural therapy. And again, I can't tell you exactly what that consisted of, but I can tell you that they did it for 20 weeks, and I'm guessing that means probably at least one session a week. So we're talking about lots and lots of sessions of mind-body work. 80% in the group that received that cognitive behavioural therapy started ovulating again, as opposed to 25% only in the control group. And then, statistically, an enormous effect, more than 3 times the number of women in the CBT group begin ovulating again. What that says is that stress levels as a result of what they did in CBT must have gone down, and therefore cortisol was not inhibiting the GnRH hormone. Live TV. I have to turn that off. I thought I'd already turned it off. I'll turn it off again. My apologies. There. What does that mean? Well, I suppose for the people involved in cognitive behavioural therapy, they're going to say, well, look how great we are. And perhaps it says that. To me, it doesn't say just that. I'm not even sure it does say that. What I do believe it's saying is that if there is mind-body work of some type, resulting to a reduction in stress, then the chances of ovulating, and again, we're talking about here non-ovulating women, is greatly enhanced. Greatly enhanced. And again, this would give some credence to the whole notion that the biggest factor inhibiting women conceiving and going on to have a healthy live birth is stress. And Mr. Schwartz is a firm believer in this line. In other words, you reduce the stress, it affects the chemicals, you affect the chemicals, you affect the birth. That's basically the view that he takes. And I'm not saying that stress reduction isn't a value, isn't important, but I don't believe it's the only factor. In fact, I'm not even sure it's the most significant factor, as I'm going to talk about later in the next program. But let's say we just address that element. We just use different methodologies, and there are dozens of methodologies for relaxation. There's cognitive behavioural therapy is just one. If we're talking about reducing stress, there may be meditation, there may be yoga, there may be all manner of mind-body works. What I'm saying to you is they're going to help. They may not be the total solution, and actually I'm going to state that I don't even believe that they're the most powerful by far, but they definitely help. In other words, it demonstrates a mind-body connection. So here we have a number of studies, and these are just the highlights. There have been many other studies, ranging from the 70s right up until 2006 and some beyond, whereby there's a deep connection. Now, why don't we see more of these studies? Well, again, I'm going to be a little bit cynical here, perhaps, some of you may say, but whenever you're conducting a large-scale study, it's expensive. Usually, the only people that can afford to conduct those studies are commercial organisations and teaching organisations, well-heeled universities and their research departments. What does that mean practically? Well, it means that from a commercial standpoint, if you are a commercial organisation such as a drug company, unless you can relate this study to some potentially patentable drug, there isn't any commercial reason in you embarking on such a study. And when I say that, this isn't a criticism of drug companies. We can criticise them for other reasons, but that isn't it. That's just a commercial reality. They have a responsibility to their shareholders and their boards. They have to make money. They're commercial organisations. There's no point in them engaging in these studies, however fascinating they might be, because what can they do at the end of them? They can't patent any of these processes. So that basically means that we're left to some individuals and some teaching organisations who are willing, and they're willing to persuade the teaching organisations like the universities and other groups to fund these studies. And unfortunately, the funding, that type of funding, is much harder to come by now even than it was in 2006, 12, 13, 14 years ago, 15 years ago. It's harder to get it funded. But I don't believe that it's necessary to keep repeating the same studies. What I do believe is it's necessary to point people to these studies to show that, that there is a mind-body connection. Now let's have a look at a comparison. I want to compare this to pure ART, assistive reproductive therapy. And for here, let's turn to the biggest and most complete study that I know of, which was conducted by the Centre for Disease Control. And I just want to make sure that you guys know the numbers, because this study, which was really a study of in vitro fertilisation, involved 92,242 women. And again, what they're measuring here is live birth, not just pregnancy. Because, you can get pregnant, but women aren't interested in getting pregnant, they're interested in having babies, and that's what the CDC realised. And the statistics are rather shocking. At first, it doesn't look too bad because it looks like 28% are able to conceive and give birth. But again, there are many variables in the procedures of in vitro fertilisation and the drugs that are used. And this is involving all of the women who received it, many of whom are on the young side. In fact, half the women were under 35. And that's just the nature of the sample. But again, it skews towards the younger women. There again, we're still looking at only 28%. Now, if you look at what happens to the women who are over 35, based upon this study by the CDC, only 21% go on to have live births. And if you're over 40, that falls to single digits, less than 10%. And by the way, one of the things that they mention is a process called IUW, intrauterine insemination, which I'm sorry to report only had, according to their study, somewhere between a 2 and 8% level of success. Very, very, very low levels of success. So if you're over 40 and you're having in vitro fertilization, the bad news without any of these things is you've got less than a 10% chance of success. Now, a doctor called Randine Lewis, in a book called The Infertility Cure, following his studies, says that very often to succeed with IVF, women are doing about 7 cycles of IVF before they either conceive or give up. And again, even if we take that at half that number or a little over half, probably you have to say that this 28% or 21% for the over 35s probably engaged in at least 3 or 4 or more cycles. How much does an IVF cycle cost? Well, whenever you're watching this, I'm sure that the cost would have gone up by the time I talk. But at the time it was written, the time this is written, this is done in 2019. The cost of an IVF cycle per cycle is going to cost somewhere between $12,000 and $30,000 per cycle, depending upon what you do, where you do it, what procedures are involved, because they're not completely standardized. And it's almost invariably an out-of-pocket expense, not covered by insurance. So here, a woman may be investing, or rather a family may be investing, anywhere from, at the low end, $30,000 to at the high end, $70,000. No, what am I talking about? If we're doing 7 cycles at $30,000 a time, 20, much more than that. 3 times of 21, 210,000. In other words, it can be an extremely expensive process with a relatively low degree of success. Now let's compare that to some of the mind-body therapies. And again, I'm not even talking about which ones are better than others. I'm not talking about that. Just generally, take your pick. Using those, you've got closer to a 42 to 65% chance of success based upon just some of the information that I've been giving you today. And let me tell you that any mind-body program that one mentions is usually significantly less than the cost of a single IVF cycle almost anywhere you do it, and is non-invasive. So that, I hope, provides you with some guidelines as to the outstanding studies and is something interesting and hopefully exciting for you to learn about. On the next program, I'm going to talk about what I believe a really good fertility program involving the use of hypnosis looks like, the sorts of programs that I do, why I do them, what components you should be looking for in a very good, successful mind-body program, how that should work for you, so that you or one of your friends and loved ones can increase your chance of having a baby, having a healthy live birth naturally, without breaking the bank, so that you can spend your hard-earned money on your children rather than just in the process of conceiving your children, and how you can use these extraordinarily powerful tools for your benefit, how hypnosis can help you. So until that time, next time, come back, look out for this show. I look forward to speaking with you then, and I hope you join me for part 3 of this exciting and revealing examination of hypnosis in regards to, and other mind-body processes in regards to enhancing fertility and reducing infertility and sterility. Thank you very much for watching this edition of Hypnosis Helps.